What's up, y'all? My name is Andrew Defy, aka the Gorilla Poet Laureate, aka the Hoodie God, aka Spitting Quarantino, aka I wear my sunglasses at night indoors because my eyes are as sensitive as my heart is, y'all. And we are back with another jam-packed episode of Masked Up, Wednesday nights at 5 p.m. at our new time. As always, we got some heavy hitters in the medical field joining us tonight. We are going to talk to UCSF's Dr. Monica Gandhi about the realities of COVID-19, the fear tactics that were used to keep people at home at the beginning of the pandemic, and how they have been harmful to the public and to the relationship between medical authorities and everyday Americans. I feel like this is one of the most important conversations we've had yet on this show. Stay tuned, all you haters in the comments. We also have powerhouse poet, nurse, community activist, and superhero mom Asantewaa Boykin joining us tonight, a co-founder of Anti-Police Terror Project and MH First, doing revolutionary work in the streets and hospitals, equipping the California Capitol with education and non-police resources for mental health maintenance. We're also going to talk about COVID from California to India and a study that proves generational trauma is passed down through DNA. As always, feel free to leave comments on any of the broadcast threads or hit us up directly at the Masked Up live stream at gmail.com with any thoughts, feedback, etc. We look forward to hearing from you. Now, let's get into it with the weekly Rona update. Both numbers of confirmed cases and deaths due to COVID-19 continue to go down in California as the state reopens. Even with a slight increase in tests this past week, we are still seeing a decreased test positivity. We are sitting at a cool 1.2% test positivity to be exact, and we continue to gain more and more ICU beds. Most of California is currently sitting in the moderate orange tier, with some counties, including Sacramento, Shasta, San Joaquin, Stanislaus, Madera, Merced, Placer, and Nevada, still in the red tier labeled substantial risk. We'll talk to our guests tonight about how they're feeling about things, but I, for one, am feeling better than I have in recent memory. It's not the finish line, but it's a major breather. The CDC just released some more clear guidelines on what is suggested for people who have been vaccinated as far as safe gatherings go. This graphic comes to us from March for Science. Keep washing your hands, everybody. And that's the weekly Rona update. While we've been getting better and better here in California, things have not been so good on the other side of the world. If you haven't been keeping up, India is being hit incredibly hard right now. Here's a piece from NBC Bay Area that will help you get up to speed on what's going on over there and what the U.S. and the rest of the world are doing about it. I'm not into showing trauma porn on this show. This is the easiest piece to watch that I could find, but still, it's pretty heavy.
Situation improves in California. It's a much different situation in India, a country with so many ties here. Cases there are skyrocketing. Today, the country reporting nearly 350,000 new cases in one day. That's setting a new global record and bringing the nation's total number of cases to 17 million. Now, the Biden administration says it will immediately offer relief. NBC Bay Area's Marianne Favreau is at the Sunnyvale Hindu Temple, where people are praying for family members hit hard by the recent wave of cases.
There is deep concern here tonight. We talked to one man who came here to pray, and he told us he has 20 family members in India diagnosed with COVID.
A new coronavirus wave hitting India. Doctors say loosening restrictions, public complacency, and emerging variants are contributing to the surge. Deep Argawal and his family came here to the Sunnyvale Hindu Temple tonight to pray for more than 20 relatives now battling COVID in India.
My father, my brother and his family, my in-laws, and they're all infected.
The temple's head priest says his uncle died from COVID and his youngest son and 72-year-old mother tested positive. He says because of travel restrictions, he can't fly to India to help them. So he relies on phone calls.
I'm calling my mom morning and evening whenever I get time. every hour.
All while continuing to join other families in prayer.
We are praying every day in our Hindu temple. We are trying to help the people in India.
With India's coronavirus surge showing no signs of slowing, today the Biden administration said it will immediately send raw materials needed for India's coronavirus vaccine production and will also send therapeutics, rapid diagnostic test kits, and ventilators. Bay Area families hope the assistance will make a difference in protecting their loved ones. In Sunnyvale, Marianne Favreau, NBC Bay Area News.
South Bay Congress.
Sending big love to and praying for all our family in India right now, as well as our folks out here with loved ones out there. If you want to donate to humanitarian efforts, there are a lot of lists and sites going around. We always encourage you to do your research. One that I found was coming up a lot was care.org. That's care.org. You know, it's hard to know who to trust to deliver this kind of aid sometimes, but people seem to say good things about them in the local media. So there's as much of a cosign as you're going to get from me. But you know, Google exists. Do your research. Call your officials. Tell them we want to send support to our family in India dealing with this latest COVID outbreak. This week's first guest is Professor of Medicine and Associate Chief in the Division of HIV, Infectious Diseases, and Global Medicine at UCSF. She has dedicated her practice to optimizing outcomes and quality of life for vulnerable communities living with HIV. During the COVID-19 pandemic, she has been a huge advocate for global vaccine access and data-driven health measures, something that sounds more simple than it is. We caught up with Dr. Monica Gandhi to talk about the dangers of fear-based messaging when it comes to conversations around masks, vaccines, school closures, and states reopening. Hey, Dr. Gandhi, thank you for joining us. How are you doing today?
I am doing okay, thank you.
Absolutely. So excited to have you here. You know, you frequently talk about the importance of avoiding fear-based messaging when communicating information regarding public health. How can we as a society improve the ways in which we communicate public health information?
You know, we somehow in this pandemic, we exaggerated a lot in terms of the risk of the virus in certain populations to keep everyone at home. So we didn't stress that this was an infection that really, very luckily, thankfully, does not infect children at all to the same degree. And in fact, children are more likely to have severe influenza than COVID, meaning they're on par in this case. And yet somehow we just communicated this overall fear about the virus. And what ended up happening is, I think, the consequence of that, which is school closures. And to this day, California especially has, only 50% of children back in school, and a lot of them are hybrid. So I'm hoping we could get back to just plain old facts and not fear-based messaging, but more nuanced messaging.
I think you said it right there. The nuance is so important in all of this. While we're talking about, fear that's going on right now, the announcement of the Johnson & Johnson vaccine pause has been an added source of fear for those who are vaccine hesitant. The J&J pause recently got lifted. Is it safe for us to take? Like, how should listeners weigh the potential risks and benefits of this vaccine?
So, the CDC and the committee really looked into the numbers, right? So by Friday, we knew that out of 8 million doses given in this country, there were 15 cases of clots. And they all occurred in women by last Friday. We have one in a man here at UCSF, so there is one man with a clot. And those all mostly occurred in 18 to 49. And so it made the risk this simple: 7 out of 1 million if you are a woman under 50, and 1 out of 1 million over 50. And that's true even with this addition of this a clot in a man yesterday. So it becomes more like if you're over 50, 1 in a million in terms of a risk. That is low. 1 in a million is low. It is actually, more risky, of course, to contract COVID-19 and get sick from it. And clots are also associated with COVID-19. So I think it's hard to message how low that risk is, and everyone has to decide for themselves. I'm personally recommending it for those over 50, but I would say this is that putting a warning label on it, I think and unpausing it was the right thing to do.
So you are a big proponent of, quote, data-driven optimism. I love this. This is like scientific joy hunting to me. So as a proponent of data-driven optimism, what hope can we hold on to right now at this point in the pandemic?
You know, we have incredible hope in the United States. I mean, I wouldn't even say it's hope, it's concrete reality, true, that over the last 14 days, we've had a 20% drop in cases. So we're at our lowest number of cases that we've been since June. It's about 33,000 across the United States. We have 42.5% first dose in for vaccination in the US. And at that number, we have also, of course, decreasing hospitalizations and deaths. And some states like California has a metric that we thought should be the right metric to lift all restrictions, which is 5 COVID cases per 100,000 in the hospital. So meaning out of 100,000 people, 5 COVID hospitalizations over 100,000. And we had written a Washington Post editorial, Ashish Jha and Sira Madad and I, that said all restrictions could be lifted at that point. We're doing extremely well. People still want the vaccine. We're not yet there. We're still getting people vaccinated. And the vaccines are so effective, to put it extremely simply. I think what I keep on looking at is the CDC breakthrough data, because we're still doing a lot of testing in this country. We're still doing a lot of monitoring for the pandemic, and 87 million Americans vaccinated. Among those, 5,069 symptomatic infections. That becomes a rate of symptomatic infection that is so low you have to put lots of zeros in front of it, but it's 0.00005 or 0.005%. And then getting sick, where you'd have to be hospitalized, is lower still, lots more zeros, and very, very few deaths. And so again, it's really hard to get it infected or sick after you've gotten these vaccines. And that's just the truth. It's just like, we're doing a lot of monitoring. It's the truth. These are the breakthrough infections. And so it just means that these are incredibly effective vaccines. We never dreamed they'd be so effective. And when we watch data from the UK and Israel that are ahead of us, we can see that they're opening, and they don't have outside mask mandates, and kids are back in school, not masking and distancing, and cases are still not going up. So all of this is proof that we are going to get there. We are going to get through the pandemic. It's just absolutely true. And so we now don't want to do the fear-based, which people may have thought was a useful strategy to get people to stay at home. I didn't think it was useful. I think it was better to just be nuanced in your messaging. But right now we can truly be fact-based, and things are going extremely well in the United States. Definitely not true everywhere.
Yeah. I mean, so we're currently grappling with the tragic COVID-19 crisis in India. What factors led to this recent rise in cases, and what can we learn from this in terms of pandemic preparedness?
You know, what happened in India is that it's a huge country, really dense population, so 1.4 billion. And before, who got infected in their previous surges really was the poor, which is true actually worldwide. And so, for example, there was a study in the Lancet in June that showed that 60% of slum dwellers, those who lived in urban slums in Mumbai, had been exposed to the virus, but 11% of the general population had been exposed. And so it clearly was extremely differential. Then the cases really went down in, about essentially January and February of this year. And people thought it was over. And that is a mistake that many people made, including me, that they thought there was so much immunity in the population that it was just going to get better. However, there wasn't. And that study actually showed us that there's, just because you have immunity in subpockets of the population that were out working or who couldn't socially distance or do any of that, that didn't mean that the country of 1.4 billion was immune. And They also had huge gatherings. There is this new variant B1617 that may be more transmissible, but the huge gatherings, the setting of these Hindu festivals that occurred a month ago also made many people come together, and it took off. And now it is terrible. It is 320,000 cases a day. Compare that, I just told you, 32,000 in the United States. 10 times the amount, 2,000 deaths a day, and likely undercounted. And fundamentally a healthcare system that doesn't have the capability to take care of this many ill, and even in terms of oxygen supply, for example, and 8.7% first dose vaccination rate, vastly lower rates than any other place that we just talked about, US, UK, Israel, in terms of their ability to have been vaccinate their population. So all of these factors coming together is leading to this terrible public health crisis in India right now, and it's absolutely terrible.
And that crisis in India has also sparked conversations surrounding the importance of global vaccine access. What is the cause of these global vaccine disparities?
Yes, I mean, it's really quite amazing that a life-threatening disease that has caused many deaths is still being bound in a way by patents. But its control is bound by patents. So what I mean by that is that there are clauses just written out sort of vaguely that if there was something terrible like a global pandemic, that there would be an ability to get global vaccine equity. But we have not managed to work this out yet. There are one strategy is the COVAX initiative, which is simply not enough. The COVAX initiative, which the United States signed, simply says that, sure, you can make your own vaccines and we support you getting vaccines. That's not strong enough. The WHO COVID-19 Technology Access Pool, which the WHO put together, literally says we shouldn't be obeying patents in the middle of a crisis like this when we have the life-saving technology of these vaccines. And the United States hasn't signed on to the COVID-19 Technology Access Pool. The United States over this last weekend did do a couple of things that were very helpful for India, but it's still not enough. What they did is when President Biden had signed the National Biodefense Act, when he came on, he had also restricted any exports. That was part of it, essentially, any exports of raw materials to make vaccines anywhere else, because he wanted vaccines to be made here. We have plenty of vaccine now. And over the weekend, he signed to partially release that export ban so more raw materials can go to India. He also said he'll donate our 60 million AstraZeneca vaccines that we had purchased to the global community. The problem with both of those moves is, again, we have 1.4 billion people, 8.8% first dose only, and this is not going to be enough. There are two things that I can think of that we could do right now to increase global access, especially to a place that is out of control. One is that the US holds the Moderna patent for the vaccine, the mRNA vaccine from Moderna, because it was developed in conjunction with Moderna. And I think that they should allow that patent to not yet be given to a company, but to allow mRNA vaccine to be made in country using off patent, essentially. And the second is that I keep on wondering why Pfizer, the CEO, has not yet messaged that they will donate vaccines to India, because there's a lot of messaging going on from Pfizer about protease inhibitors and about boosters that we may need in the United States. But I'm surprised that we haven't yet seen Pfizer stepping up to say, we're going to donate some doses, 100 million, 200 million to India.
I want to touch back a little bit on messaging. Important public health practices like mask wearing or getting vaccinated have become super politicized. How can we help loved ones who are skeptical about mask wearing or vaccines become more receptive to these life-saving practices?
I think it's actually, again, partially the problem in the United States that we like to use sound bites. So the phrase stay at home is really non-nuanced. Like, it could have been if you can stay at home, but if you're an essential worker or you want to see people, let us tell you how to stay safe. These are the practices, mask distancing, ventilation, that we can use for safety. And that is called harm reduction messaging. Harm reduction is the idea that you actually want to reduce infections just like someone who uses non-harm reduction messaging, but you use it within the parameters of reality, that people may have things in their lives that that is not always just completely about avoiding risk from a pathogen. And so I think that if we had done that from the beginning, the phrase mask up saves lives, I find really, again, non-nuanced, and it invites skepticism. It invites this question of that's not nuanced enough. Outside is safer than inside. Outside masking wasn't recommended by the World Health Organization from the beginning. We didn't do anything in a nuanced way. We just did these kind of blanket statements, and I think it led to distrust. And then in terms of politicization, there was politicization on both sides, because I think that David Leonard put together this New York Times piece where he said Republicans underestimated the risk of the virus and Democrats overestimated. By doing that, none of us made sense, actually. We should have just completely just pure facts, like facts mount, like just data-driven approaches, to not exaggerate to make people believe that no matter what, if they left their house, they were going to die on one end, or exaggerate on the other end that COVID-19 wasn't a serious illness. So none of us did this correctly. And I feel like harm reduction, the reason this is so important to me, and I'm passionate about this, is I've actually worked in a viral epidemic for the entirety of my career called HIV. And we quickly went away from these kind of over-exaggerated messages. Oral sex is not as risky as receptive anal sex, period. They're not the same. And being more nuanced, this is the level of risk of this is the level of risk of this, led to trust when we messaged about how to stay safe from the HIV pathogen. And so I feel like I wish we had used harm reduction from the beginning, because a lot of HIV practitioners were saying this, and now we're at this point where we can't even seem to talk about things without nuance. It's either you believe in masks or you don't. It's either you're going to get vaccinated or you're not. And I know we can change even at this point.
This is such an important conversation. I'm so thankful that you're here to have this conversation, because this virus didn't register to vote Republican or Democrat. Is
right.
The reality of it, right? Like,
right.
So I want to hear from you, because we have someone on the show who's saying this there's nuance to this, that it's not completely one or completely the other. For folks who have been vaccinated, what's safe or not safe for us to do now? Do vaccinated folks still need to wear masks and social distance? I know we got an update today from the CDC, but we want to hear from you, because you're not trying to scare us.
Yeah, no, I'm not. And in fact, I will say that pretty much this is the way I would think about it. I think if you're vaccinated, there are going to be social norms still in place, which would be polite of you to observe, but you basically can do anything you want. What I mean by that is that going inside in a store right now wearing a mask is respectful, because those who are unvaccinated are still in the store, and that's going to be the requirement of the store, mostly inside. And I call that a social norm or politeness. But do I think that you're going to get COVID-19 if you're vaccinated? No, I just told you the breakthrough rate is so vanishingly low that we're scouring kind of to find them. It's really hard to break through with symptomatic COVID after getting vaccinated, and that's even in the setting of still circulating cases, which are coming down. So we have to remember that the community prevalence matters too. As we come down with cases, as we have fewer cases, you're not at risk, even if you weren't vaccinated, because you're not exposed to the virus. But luckily, being vaccinated, we're really safe. So going to gyms, going to restaurants, indoors, going to traveling. I mean, my best example is my parents are 80 and 87. And 2 weeks after their second dose, we put them on a plane, 3 doctors in our family, and they came and visited me for 2 weeks. And then they went and visited my siblings for 2 weeks in Boston. And they're doing everything, inside dining, everything. They're 80 and 87 because we believe in the vaccines. So you can do anything you want, but be respectful of societal norms right now. And that's the best way to describe it. We shouldn't be describing breakthrough infections as frequent. When you say 5,000 out of 87 million, that's not frequent. It's very low. And those were symptomatic. In terms of getting ill, they're even lower still.
All right, so we're down to the end of this interview, but I have a question that I ask everyone who comes on this show, because again, I'm an expert joy hunter out here. So I want to know, where is your joy coming from these days?
You know, I actually do have joy that the CDC released the outdoor mask mandate today because I've been hoping they do that. That really made sense to me in terms of the low risk of outdoor transmission. And my joy is going to be taking my little dog Frodo, who is teeny tiny. He's like 5 pounds. He's ridiculous. He's like, looks like a stuffed animal with batteries. And I'm going to take him out for a walk today without a mask.
Beautiful, beautiful. Well, before we get out of here, do you have anything else you want to say to the people? We have half the internet that watches this show.
I will tell you that the only way to get through a pandemic is developing immunity to that pathogen, period. And we on November 9th got vaccine candidates, and now we have more than one that will get us through this pandemic. In places that are going fast, it is getting over. Life will be normal. Life will be okay. And it is amazing what we had the advantage of these wonderful vaccines.
Thank you so much for joining us, Dr. Gandhi, and for all the work that you do. This has been an incredible conversation, and I think really helped folks to kind of sort out a little bit of the fear mongering and what's real and where the nuance kind of lies. So we just really appreciate you, and we will have to have you back on.
Okay, thank you for having me.
All over. Absolutely.
Thank you for having me.
So we all know about post-traumatic stress disorder by now, right? When something traumatic happens to you and causes anxiety after the fact, just thinking about it kind of explains itself, right? And we all know how genes work, passing down DNA to children from parents, right? So what if PTSD can be passed down through generations? That's exactly what psychiatrist Dion Metzger's experience suggests, and a study published in Brain Science agrees. Trauma can be passed down epigenetically. This means passing the effect of trauma exposure on via DNA and it actually changing the expression of genes. Check this piece out from WTKR in Virginia.
I'm here at Fort Monroe in Hampton, once known as Point Comfort, the very spot where the first enslaved Africans arrived in America 401 years ago in 1619. The atrocities my ancestors endured, packed and stacked on slave ships like pieces of property, brought to this country to build it with their blood, sweat, and tears. Psychiatrists say trauma like that can affect a people for generations. 7-year-old Wenta Amore Rogers' passion during a recent protest in New York struck a chord across the country.
The amount of passion in her voice, in her eyes for a child that young made me not just see her, it made me see our ancestors before her.
So that little girl learned that from history. She learned that from her parents. And that's even like why it's so important for us to continue to tell the stories.
Nationally renowned psychiatrist Dr. Dion Metzger says the unrest we see today is 401 years in the making.
And the point of slavery, to the point of, whippings and killing and lynchings, even, in generations after that. But the issue is that fear gets instilled into the children because parents are trying to protect their children. So that fearfulness, I think, is what's passed on, in addition to the trauma, just having to deal with the physical abuse, the sexual abuse.
Hampton Roads has long been a significant location in the dark history of racism.
Metzger says the outcry we're seeing today at peaceful rallies, sharing stories and fighting against injustice can be a form of healing.
And it's not going to be a quick fix. Us telling our stories is one big part of it. I'm a psychiatrist, I'm going to say therapy. It's like at this point, with all the images that we're seeing, all of the videos, it's a lot. And a lot of people think in order for you to suffer from PTSD, you have to be a victim. So you would have to then one of those people like George Floyd or Breonna Taylor. No, you can still have the same traumatic impact just from watching the video. And sometimes it's even greater if you identify with the person.
Is it possible that as Black people, we are experiencing a PTSD from what they went through 401 years ago?
Absolutely. Absolutely. Just because we didn't experience it, us learning about the history or even from family stories, it's the same thing.
And that's why for so many in the Black community, it's not only about George Floyd, Ahmaud Arbery, and Breonna Taylor. It's about the trauma that began right here in Hampton 401 years ago. In Hampton, I'm Jessica Larche, News 3.
With that, we're going to get into our second guest for the night. She is an RN, a community leader. She is a warrior, poet, badass, mother, sister, mentor, wifey, squad leader from somewhere in the stars. Welcome, Asantewaa Boykin, to the show, y'all. Hey, we are here with the one and only Asantewaa Boykin. Again, our first return guest to the show. So, how are you first and foremost?
I'm well, thank you. Getting up every day, doing the things.
That's it. So it's been a minute since we've talked. You were on the first version of the show before we had sponsors in this fancy studio. We talked in the middle of the pandemic.
Mm-hmm.
So I just want to check in and see what the new report is. Do you feel like we're turning a corner on this COVID thing yet? What's the view from your everyday?
So I think the vaccines are definitely making a difference in the amount of folks that we're seeing and also in the acuity of the folks that we're seeing. And I remember last time we talked about like defining those things, right? So meaning that we're seeing less patients and the patients that are COVID positive are not as sick as they were before, meaning they're not ICU patients.
So is it okay to be cautiously optimistic right now? that was a sigh of maybe not cautiously optimistic yet.
I want to be cautious because I don't want to like give the impression that we don't have anything to worry about. Right. I think it's a lot of we don't know and enjoy your life while being responsible.
I love that. So for new viewers, in addition to being a nurse, Asantewaa is an amazing poet. And when she's not working at the hospital, she's organizing with the Anti-Police Terror Project and MH First. The MH stands for mental health. Basically, you know how people are always like, there should be someone besides the police to call? Her and the crew are those people. And they are entering their second year. Congratulations. How is MH First going, and how can the community support you further in what you're doing?
So MH First is going well, right? Folks are utilizing the service. We've had interest in other cities inside the state who want to replicate what we're doing in Sacramento and also in Oakland. We have Sac County gave us some money to do trainings, and those trainings are really like giving the things that we've learned to the community so they can use it themselves. And also, if you want to volunteer, being trained is a great way to do that. So we did our first training back on the 11th. We have one coming up in June, and we'll be doing those quarterly consistently for the next 2 years. So really the goal for that is just giving folks the information that they need. So not that they have to call us, but just so they could manage those situations like on their own, right? Without having to involve anyone. And the hope is that it will decrease the stigma around mental health because everyone will know the lingo, know how to get services, where to get services, and what you can do if services aren't available.
So let's talk about one of your other projects as well. Let's talk about the Anti-Police Terror Project. Tell us a little bit about the history of APTP and what y'all have been doing. And also, again, how can people get involved? Everybody needs to get involved in everything Asantewaa is doing, period.
Okay. So APTP started. So one of my coping mechanisms is forgetting dates. So we've been, I'm like, when was that? We've been in operation as APTP 8-9 years, I think, like in that realm. Prior to that, we were the Onyx Organizing Committee. What we had found is after Oscar Grant was assassinated, we had the ability to like bring people into the streets, right? Like in response. But as we began to form APTP, we formed that group with the intent on preventing more Oscar Grants, right? Preventing more Antonio Thomases, right? This was the goal. So we created our First Responders Initiative, and that was how we learned over the years how to investigate independent incidences of police terror, right? So we went out and taught a bunch of community members and organizations how to do that. And what that did is we really found that we were able to change the narrative around what happens after these incidences of terror. And then also like encouraging people just to pull their cameras out, right? Like you don't have to be cop watching, you don't have to be, doing the work, but just like film that shit, right? Know that the corner store where it happened in front of doesn't have to give over their footage, and they definitely don't have to give over the original, and you have every right to ask for it. Shop owner could say no, but closed mouths don't get fed, right? And then also that is the spirit under which MH First was created, right? We had conversations like, can we do this for the larger community? And the answer was yes, and we just decided to do it.
And what is, there's a lot of arguing over the verbiage, right? What is the biggest misconception people have about the abolish, defund the police movement? And what would you like these people to know about what defunding the police truly means?
It means that we can't continue to let police departments extort our city budgets. If we put it in perspective, right? Like if the police did not have badges and weren't sanctioned by the state and engaged in the same behavior, we would call them hoodlums. We would call them organized crime. We would call it extortion, right? So when you look at it from that framework, like the city budget is almost 50%, right? So if someone stood outside of my home and was like, I'll keep you safe, but I'm gonna need 44% of your paycheck, and I am in fact not safe, you know what I mean? Like I could call the end quote police to come and arrest that person. And this is how our police departments are currently behaving. So I would say, call it what it is. It's extortion, right? And then I would tell someone, well, where's the money for our roads? Where's the money for our schools? We can afford to put 10 unhoused people in a home on one officer's salary for a year. So if you're really concerned about homelessness, why don't we fire an officer and build some low-income housing or no-income housing for folks who need it, right? Instead of calling an officer to get that person away from your property, right? In medicine, we call it patient-centered care, right? Not care that's centered around the doctors or the professionals. So if we have a citizen-centered government, then that means that we have less police. We spend our money housing people. We spend our money getting people care and education and not incarcerating them.
Now, what patterns are you seeing? Because you're not only working with MH First, you're also in the hospital. What patterns are you seeing mental health wise with the pandemic and the increased coverage of police killings this year?
It's not, and this I pondered on this one, and it's not something that's direct, right? Like people are not saying that there's all this stuff in this news and it's freaking me out, right? They're not saying that. They're saying things like, I can't get rid of this uneasy feeling, or I'm like extra like restless, or they're saying that there's just no point, right? And folks can be saying these things outside of these incidences, right? This is not uncommon language. But what I've noticed is more often folks are unable to name it, right? Usually there's like a precipitating factor, like, oh, maybe I'm about to be evicted, or maybe there's a strained relationship with the family member. There's been studies that have shown that when these incidences happen, that folks experience that secondhand trauma, right? So like direct trauma would be, I saw it, right? Like it happened right in front of me. Secondary trauma would be either like I heard about it or I saw it on the news. And I would argue that anyone who watches those videos are experiencing that firsthand trauma, right? So sorry. So yeah, even though folks aren't able to like name those things specifically, it definitely and undeniably has had an effect on the population.
So in addition to being a warrior, you are also a healer. What can people of color do to practice self-care right now? And how can white family best support our family of color in that practice?
I think especially because we live in a capitalist society, right? Like we don't have the time or the space just to be still and sit and process. So I would say start there, right? We know that it brings up these feelings of like insecurity, mainly rage, right? And it's really hard to sit in rage without being destructive. But just sit in whatever emotion that you're having and let it run its course. And the reason why I mentioned capitalism is because we got to get up and get back to work in the morning. We got to get up and, take the kids to school or load them on their Zoom classes. But even if it's 5 to 10 minutes at a time, just sit in that emotion and let it run its course, because those things stay in our bodies, right? And they start to create things like diseases and hypertension. And that's where we get all like the stress-related diseases. So just allowing yourself time to like process the emotion. And then if you happen to be, and specifically, right, because we talk about like secondhand trauma. So the families of folks who have experienced police terrorism firsthand, right, like their family members, it's re-triggering, right? Like I can't imagine what these folks are going through, like seeing these situations play out. And even though the verdict was a good thing, right, for the Floyd family, I can only imagine there's so many folks wondering, well, how come my son or daughter's killer wasn't prosecuted? And like, what was different about my case versus this one, right? Like having those thoughts and maybe even feeling guilty about having those thoughts. So we have resources for folks who have experienced police terrorism firsthand. Our Healing Justice Committee will do what we can and how we can to help you find that time to process whatever it is you're feeling in the moment. And then also, if you just happen to be a Black woman, we have a Black Women's Wellness Fund, which the community has like poured love and resources into. And I'm just so like juiced about it. We've even been able to identify like a program that's for POC mothers specifically. And we're going to like sponsor a student to go through that program. And that program is all about self-care and how to love yourself as a person of color and a mother. Like, it's just so fucking amazing. Like, that's like the heart, you know what I mean? Just like taking care of people. Anywho, so you can donate to either one of those situations, or if you're a Black woman, or if you experience police terrorism firsthand, go get the care, man. Just take the time. And we're non-judgmental. We don't care if like your self-care looks like a movie or a massage, whatever. Just send us a receipt. We'll foot the bill for that stuff.
Word. And we are going to put a link right down here where you can do that, where you can donate and you can be a part of that healing here in Sacramento and beyond. So you know what it is. Every time that I have anyone on this show, we have to ask, where are you finding your joy right now?
Today I'm finding it here, actually. Like all the other things I have to do today are gonna be like super heavy, you know? So like I was really excited when you were like, let's do this. I was like, fuck yeah, yep. So right now, it's being right here with you, and I appreciate it.
Beautiful. Well, you know, the other thing that I need from you is because you go back to the days where we used to have artists on here all the time. And it's been a minute since we had an artist on. I think it's been since Kimon was on. It's been a way too long since I had any poetry on this show, and it's National Poetry Month. Is there any way that we could get a poem from you before you get out of here? Yes.
It was August 7th, 1950, on the east side of Oakland, California, Highland Hospital to be exact. The exact same year that the television was invented, magnolia still lingering on my grandmother's skin. As I do, on days where silence hides, I suppose you wavered between feeling absolutely magical and as useless as you. Black, brave, loud, you, demanding, you shushed often but never silenced. I often remember the whites of your eyes, which were not white, but a dusky golden brown, the same brown that let us know that the mac and cheese was done. Or that your voice would soon echo between project buildings like prophecy followed by promises of pain. Funny. The notion of your wholeness had never occurred to me, and I wonder if it had ever occurred to you. We watched you swallow your sadness. It was nameless, but had a designated spot at our table. Laughter. When it left your mouth, it pierced clouds and left rainbows in its place. You loved with your sharp parts. I must have been selfish in a past life. Likely a coward who chose silence when screaming was in order. Certainly my former self had taken happiness for granted, or had been so covetous that they have forfeited their own magic. It was September 18th, 2015, in sunny San Diego, California, Alvarado Hospital to be exact. Thank you. I couldn't have chosen a better teacher.
Thank you so much for that. I love that line, you love with your sharp parts. Like, I've been that person and I know that person.
That person raised me. That poem was for my mother. I love her. She passed on, but she was a brave woman. You know what I mean? I appreciated her presence in my life, for sure.
She's definitely still here every time we see you and her reflection. And just thank you so much for everything you do, everything you are, and for stopping by and blessing us today. And you know, continue to take care, and we will continue to support everything that you are doing and everything the family is doing. And yeah, that's it. Anything else you want to tell the people before you get out of here?
Look out for Love, Lyric, and Liberation, which will be my first full-length collection. Don't have an exact publishing date, but just keep your ear out. Also, I have a chapbook called Odes to Fuck Boys, because somebody needed to write it. Yeah. It's on my Etsy page, which is just Asantewaa RN. If you're looking for me anywhere online, it's Asantewaa RN across all the platforms.
And with that, we are at the end of another episode of Masked Up. I hope you learned something. Feel free to share this with a friend and make sure you go follow our sponsors that protect us. I'm Andrew Defy. As always, shout out and big thanks to Netta, Suchita, Allison, and the rest of the Masked Up show crew. This show would not be what it is without your time, energy, and love. From all of us to all of you, like Mozzie said, health is wealth and I need my bag. Covered faces don't get cases. Health doesn't come from a pharmacy, y'all. Till next time, stay masked up. And keep washing your hands.